Devastating. That is the word that comes to mind when thinking about CRPS. Let's talk about CRPS. Let's raise awareness about CRPS. Let's allow people to diagnose CRPS correctly and early, which will lead to better outcomes. I see many people referred into our clinic with a diagnosis of CRPS. Please, can you help? And it's not CRPS. And I see the opposite. People get referred in with other pain diagnoses that they've had for a very long time, and they've got full-blown CRPS that hasn't been managed early and hasn't been managed appropriately. So that's the reason for this discussion on CRPS. Let's raise awareness. Let's talk about it. I'm going to use a presentation to give you an overview. So that is what CRPS looks like. It is a pain condition where you can see the condition, and it's very uncommon to be able to see a condition that has, or see a pain condition. So for example, with pain, we have to believe what we are told by the person sitting in front of us. With CRPS, you can sometimes see the features of pain, see the features of the nervous system malfunctioning. And that allows us to make a diagnosis early if you know what you're looking for, if you understand what this is. So there are two pictures on the left-hand side, on the right-hand side. The left picture, you can see differences in the leg. One is a little discolored, one is a little shiny, one might be a little swollen. And the picture on the right side as well, the right leg, you can see there is definitely something happening here. Is this an infection? Is this a vascular problem? Or is this some other medical problem? And sometimes they overlook the fact that this is complex regional pain syndrome. So let's dive in. Let's have a more of a view on complex regional pain syndrome. So this is an overview on CRPS. It was first coined in about 1864 by Silas Mitchell in his publication called Gunshot Wounds and Other Injuries of Nerves. What does that actually mean? And he noticed this looking after people that were involved in the Civil War and had sustained gunshot injuries. It is uncommon. It is common in clinics like this because we see pain, but out in the community it is relatively uncommon. It is severe. There is normally a minor trigger, or what we call an initiating event, that starts the process off. It generally occurs in the distal features, which means the hands and feet, but I have seen CRPS in the knees, I've seen CRPS in the hips, I've seen CRPS in the face and shoulders as well. So it can occur in other parts of the body, but generally hands and feet. And it is devastating to a person's quality of life. They get into this vicious cycle where they are trapped, there's no way out. It affects quality of life, and it affects level of function. And again, the word that comes up over and over for me is devastating. I think in this publication he called it causalgia, which is from the Greek terms, and it means burning pain, and that is exactly what people describe CRPS to be, or certainly one of the descriptors that we get given. Let's talk a little bit about the actual specifics of the condition, so the so-called epidemiology. It occurs in between 5 and 26 out of 100,000 people. It doesn't sound like a lot, and again, but it is fairly common out there. If you understand what the triggers can be, it's relatively common. It occurs far more in females than males. I can't remember when I last saw somebody with CRPS that was a male. It occurs generally in people that are 50 to 70 years old, but absolutely can occur in younger people as well. I haven't seen it in particularly older people, and it might be because you need to have a fairly robust immune system, which is part of the problem, which we'll come to. It generally occurs in the upper limbs more than the lower limbs, it can occur in more than one limb, and it can occur on the opposite limb. It can cross over to the other side of the body as well. So it can do some odd things. Genetics do play a role in complex regional pain syndrome. If genetics play a role, it is generally in the younger person. They generally have more than one site, and it can occur with the dystonia, which is the contractures that can occur. I've seen family members with CRPS. Stress is important as a role in CRPS. It can what we call potentiate it. It can help it to linger on, make it more difficult to manage, and PTSD is also a factor in CRPS. So we actively manage post-traumatic stress disorder. So let's talk about the causes of CRPS, because people need to understand what the causes are. If you understand the causes, you can start thinking about whether this is complex regional pain syndrome. And remember, one of the factors with CRPS is it can be caused by a minor event, not a significant event. So let's have a look at the causes. The big causes of CRPS are fractures. Fractures to the hands, wrist, fractures to the feet. Sprains and strains, so a really minor injury, you just kind of twist your ankle, you sprain your wrist, and it can trigger CRPS, a minor injury. Elective surgery is a big factor in complex regional pain syndrome, triggers as well, and of course there are many elective surgeries out there. We see it commonly or more commonly in orthopedic surgery, hands, feet, and knees as well. But of course shoulders, it can occur in shoulders as well. So fractures, sprains, and surgeries, those are the big ones. Crush injuries are a known cause of CRPS as well, but again, not a common cause of CRPS. So those are the big ones. So if you've had a minor injury and you've got this lingering pain with these features that I'll describe in a few minutes, do you have CRPS? If you've had a fracture, and so people that diagnose and treat fractures should be thinking about CRPS. And of course, elective surgeries, notably orthopedic surgeries, but any surgery on the hands and feet or the limbs can trigger CRPS. Other causes of CRPS: dislocations, immobilization. There have been studies looking at just wrapping up an arm in plaster of Paris or some kind of splint for a period of time. And these studies have shown if you just immobilize a part of the body, you will develop features of CRPS. They might not be severe features, but they will absolutely occur. Tendinitis can trigger CRPS. Arthritis can trigger CRPS. Not common, but it has been defined. Deep vein thromboses, mastectomy, other injuries can trigger CRPS. There have been injuries to the nervous system, so brachial plexus, peripheral nerves can trigger CRPS, so a nerve injury. CRPS can follow central nervous system, CNS, disease processes. So strokes, tumors, brain injuries, they can also trigger CRPS. Even myocardial infarction, so heart attacks, have been known to trigger CRPS, and there are case reports on this. And then the one at the bottom is idiopathic or spontaneous, which means it can occur for no reason. Generally, there is an inciting event, there is a trigger. It's minor, but it can absolutely occur. So those are the causes of CRPS. The big ones are fractures, the big ones are minor sprains and strains, and elective surgeries, notably orthopedic surgeries. A reminder, hand surgery, wrist surgery, knee surgery, ankle and foot surgery. These are the more common features or triggers of CRPS. It doesn't say that these surgeries commonly cause them, but they are associated with them. And that's just a reminder that any form of immobilizing the body can cause CRPS. So if a person is put in a cam boot for a sprain, you have to be concerned that they may develop the symptoms of CRPS. Right, let's move on to the mechanisms of complex regional pain syndrome, and they are complex, they are ever changing, we're ever understanding new mechanisms of CRPS, but let's go through a few key features here. Genetics are a big factor, as I said, particularly younger people, particularly people with the dystonias that can occur, and it can occur in multiple parts of the body or multiple limbs. Let's focus on the inciting injury. So what you've got is you've got some kind of trigger, a trauma to the body in some way. Injury, immobilization, something we call ischemia and reperfusion. So if there's a part of the body that doesn't get blood flow for a period of time, and all of a sudden there's a whoosh of blood back into the body, that can trigger CRPS. And autonomic dysfunction. So the autonomic system is a part of the nervous system, and that can malfunction. So top left, let's have a look. There are neuroimmune factors, so immune factors within the nervous system. There are genetic factors, and as I said, there are environmental factors. And you put those all together, and you can start developing these triggers, these factors that can put you at risk of CRPS. So you've got an injury. That can affect the neural system. So the injury to tissue, the tissue changes, the tissue affects the nervous system, because this is a condition of the nervous system. And you get inflammation within the nervous system, and you get what we call neuroplasticity. So the nervous system changes detrimentally. So the neural system as a factor is a contributor. Then if you go to the top part of the diagram, the immune system is a key factor in the development, potentiation of complex regional pain syndrome. There is inflammation, which triggers the immune system. There is what we call endothelial dysfunction. So the blood vessels, the walls of the blood vessels can change. They can become more leaky. They can leak out chemicals and other things that can promote complex regional pain syndrome. Tissue hypoxia occurs, which means that there is a relative small bits of lack of oxygen within parts of the tissue that may play a factor. Complement, which is a form of inflammation, can be activated. So you can see how this is quite a complex condition with complex mechanisms. Autoimmunity, so some are now saying that CRPS is an autoimmune condition like rheumatoid arthritis and other autoimmune conditions. So this is a fascinating area which we're learning more about every year. And then one of the things in the neural system that occurs is you get changes in the peripheral nervous system, which is not in the spine and brain, and then changes within the central nervous system. And these changes, these neuroplasticity, neuroinflammatory changes, are a key factor in triggering CRPS. You get what we call peripheral sensitization. So the nervous system in the periphery becomes very sensitized. So that the nerves become hyperactive. They turn on when they shouldn't be on. They should be dormant. You get glial activation, and glial are the supportive structures, the supportive cells within the nervous system, because interestingly, the central nervous system requires cells to help it function, and the glial cells are part of the structure and support for the nervous system. So not only does the nervous system malfunction, but the tissues, the cells that support the nervous system also malfunction. You get changes within the central nervous system as well, so the brain and spinal cord, and everything just in a word goes haywire. And then of course there are, top right of the diagram, there are independent risk factors. So if somebody's psychologically vulnerable, been involved in trauma, been involved in a workplace injury, something that we call external environmental factors, again puts people at risk of developing this problem. So as you can see, the mechanisms are complex and they're ever changing, and we're always involved in research studies to better understand CRPS. What are the clinical features of CRPS? Again, this is the fascinating part about it. You can generally see this condition. There are positive features, there are negative features, there are what we call autonomic features, and there are motor features. And I'm going to elaborate on these in a little further on the next couple of slides, but there's a temperature difference between the limbs. There is a size difference between the limbs, there is a color difference between the limbs, and there is an even a more deeper difference, a difference to the hair, a difference to the nail growth, a difference to the tissue underneath. The tissue can become quite contracted, and of course even the bones can change as well. So have a look at this diagram, and this is of a real patient, and you can see the left foot, so the foot on the right, is darker. There is less hair on that ankle shin region, as well as less hair on the foot. It's a little shiny, so it might be a bit swollen, and that blue line is the same on both feet, the same length on both feet. And as you can see, that there is definite swelling of that limb as well. If you touch it, it's going to be different as well, and that's another part of the clinical diagnoses. So let's go through this again. So there are changes to temperature. So one part of the limb might sweat and the other not. So you touch them, you ask the patient these features. It changes color. So we can see that, and there are various colors that it can change too. So early acute CRPS is bright red or red, dark. Later on it becomes mottled and then colder as it becomes a chronic CRPS. If you touch the area with a brush or a toothpick, it can be hypersensitive and exquisitely painful. A brush shouldn't hurt, it should tickle, but it doesn't, it hurts. It's called brush allodynia. And a toothpick causes a little bit of pain, which is excessive. So toothpick, hyperalgesia, excessive pain. And there are other features that can occur. Hyperpathia, which is a lingering pain. It's almost like an aftershock. You can see that there is swelling in that area as well. So the foot becomes swollen if you examine it closely, and we should, of course. There are temperature changes, and that's sometimes one of the diagnostic mechanisms. We actually measure temperature in the area. So the history of CRPS, it changes over time. You can get this acute, early, warm, swollen, red, glossy, high inflammatory complex regional pain syndrome, which is what happens when it is triggered. It then becomes a little cold and mottled. So there you've got the acute, red, swollen, inflammatory phase, which is generally easy to diagnose if you're looking for it. Then you've got the intermediate, cold, mottled, cyanotic phase, and then later on you can see the clinical change, the clinical features that you see generally disappear. It just becomes severely painful, but you can get what we call motor trophic changes as well, where you get cramping and contractures, and that's a low inflammatory component. And this is an issue because we see people that undergo medical examinations, independent medical reports, and experts say this is not CRPS because it doesn't fit the diagnostic criteria of CRPS. And that is true because it's not acute CRPS. But chronic CRPS is a completely different beast. It's a completely different pain condition. It requires a different treatment approach. So chronic CRPS is completely different to acute CRPS. You can see top left, there's different nail growth. The hands look different to each other. If you have a look immediately below that, you can see the right hand doesn't close, so there are contractures within the right hand, and sometimes it's because of pain and sometimes because of tendon muscle changes as well. Sometimes it's weakness, and similarly on the pictures on the right hand side, have a look at picture B. That right hand doesn't open up completely, which is devastating. You're right-handed and you've got CRPS, your hand doesn't work. It's effectively like your hand is not there. which is something that people describe. They say that it feels like this part of my body is not connected to my brain, and we see that a lot, and that's part of the treatment approach, is to reconnect the limb with the brain. And of course it is connected, but it effectively is, whilst it is connected, is effectively disconnected electrically, neurologically. So that's an overview of complex regional pain syndrome. I hope that's been insightful. It is important to understand this condition. It is important to share knowledge about this condition. It is important to talk about this condition, because that way we will allow earlier diagnosis. If we can diagnose this early, we can absolutely treat this far better than we are at the moment, because we're not seeing it early enough.